Good afternoon, and thank you all for being here today. I want to begin on this Monday afternoon by once again thanking the people of this great state, the people of Mississippi, for your resolve in this fight. It is not easy, and it is not fair, and it is not over. We have to keep fighting the coronavirus. The threat is not gone, and even as we all want to move on, but we must stay vigilant. We do know that while the threat is real, and it is here, we have to stay sharp in our efforts to combat it. We cannot give the people of our state more than they can handle. Today, we are announcing some additional steps that we believe that at this point we can take safely to reopen our state even further. Now keep in mind, there's a major national debate going on about reopening states. As I said many times yesterday, the term reopen means different things to different states. I'll give you one example. Not too long ago, I heard the governor of Connecticut. He said that he thought he may begin reopening his state around May 20th, and that he would do so by reopening outside construction and manufacturing. Those two industries have never been shut down in Mississippi. They have been open if determined safe by those entities since the beginning. So reopen means different things to different states. Our Safer at Home order is set to expire 1 week from today, on Monday. I don't want to wait. If there are steps that we believe we can safely take now to ease the burden on Mississippians from this virus. One of the things that I have personally missed most is sports. I couldn't imagine a spring without watching my girls play soccer or basketball or softball or whatever sport your kids may like to play. It has broken my heart to see them go without it, if only for several months. We also know that the virus does not fare particularly well in the sun, and we do not believe that it fares particularly well in the heat. To be outdoors is about the safest place you can be. We are revising our order today to open more outdoor spaces, and we are revising it to change the restriction on social gatherings to allow for outdoor gatherings only of up to 20 people. That should be a large enough group to let kids get out and swing a bat or kick a ball or shoot a basket in the sun with their teams. You can get together with your family. It should help people start to return to normalcy. It is not a dive into the deep end. It also still requires you to be smart, to be diligent. If your kids are practicing on the field, stay in your car. Please do not gather in groups around each other. Still be smart. Practice social distancing. This is a good faith step in the right direction. We are also following some of the best practices for health and safety that we have seen around the country and around our state in restaurants. There are thousands around the state that are set to close their doors for good. They cannot hold on very much longer. Carry out and drive-through are great if you have a drive-through window. Most family-owned restaurants are not so lucky, and their staff have been amongst the hardest hit. I am going to revise my order today to allow for outdoor and in-room dining with strict social distancing guidelines. There are rules that they have to follow. masks for servers. They're going to have to close tables. No more than 50% capacity. I know this is not as far as many of you wanted us to go today, but it is a start. We'll continue to evaluate it, and we'll move up from here when the time is right. I hope that this will not only be some much-needed relief for those restaurant employees, but also provide some hope and some joy for the people of Mississippi. I also believe that it could even help to be able to improve safety as it potentially reduces the overcrowding in our grocery stores. We're not yet back to normal, but we're climbing out of the ditch day by day. Working together and being smart and understanding personal responsibility, we will get there. I want to talk about one of the few industries that remains ordered closed. It's one that I want to open badly. It's one that my wife wants me to open badly. It's one that many Mississippians want us to open badly. And it's our barbers and our salons. These, for the most part, are small, family-owned businesses. They are hurting. I have asked our health experts, our lawyers, and industry leaders 100 different ways we might reopen. We've probably spent more time on this topic than any other over the last 14 days. We will get there, but I cannot do that today. Yesterday, I listened as Dr. Burke said that she urged states not to reopen salons and barbers, even in phase 1 or phase 2 of their reopen plan. I want you to get back to work, but I can't put the people of our state at unreasonable health risk to do so. Here's what I can do. I've instructed my team to come up with a plan to get some stabilization money out to salons and barbers from the CARES Act funds. It won't be enough to make up for all of the pain you have suffered. It's not a replacement for your ability to earn a living. It's just something I can do to help keep you stable. I wish I could do more for everyone. I can do this. We're working on the details, and those will be coming very, very soon. I do want to say that plans such as that are threatened by the reckless action of the Mississippi legislature in a hastily called meeting late on Friday afternoon. They voted to strip the governor's authority to spend emergency funds for the first time in our state's history. They are trying to throw out the playbook in the middle of this pandemic. This money is the first time they have raised a voice during this period of many disasters about limits on emergency powers. It feels like 10 years ago, but just a few weeks ago, I used my emergency powers to order Mississippians to stay at home, and I used my emergency powers to close Mississippi businesses. I hated it. It hurt me inside. I was dragged through the mud in the national media for refusing to do it for weeks, and we lifted it as soon as we possibly could. I have been attacked by many on both sides for my desire to keep our economy fully open for as long as it was safe, and also I've been attacked by those who have said we should open sooner. I've used those emergency powers in such a way that I never, ever imagined. It's extraordinary power that I never asked for, and it's extraordinary power that I never wanted. I couldn't believe it was within my authority, and I really couldn't believe it was my responsibility. but I did what I had to do at that time. The Mississippi legislature never once objected. Then the federal government sent money. They sent emergency funds to help us get supplies and aid to the very people we know who needs it. In every typical emergency, the governor and state agencies spend federal funds because there's no time for 174 legislators to take weeks and weeks and months arguing over where they want it to go. It's how Mississippi has always done it. It's how we pay for more unemployment staff. It's how we pay for relief for small businesses. It's how we will pay for aid to our cities. And it's how we have paid for supplies, PPE, for our hospitals. The same emergency laws which tell me that I have to handle everything else give me that duty and that responsibility. Now, the legislature objects. They scrambled to come back and pass a rushed law to strip our authority to spend CARES Act relief funds. Now, not to end our ability to make rules that affect you, just to take control of the money. That's all they're concerned about. They're going to debate how each legislator wants to spend it. They're going to do what legislators do, and they're going to cut deals, and they're going to divvy it up. It may take weeks and weeks. It may take months and months. And they can do all of that because, as was said on Friday morning by the Lieutenant Governor, we don't need to act with, quote, immediacy because, quote, it's not like we have a Katrina event here. This is power politics at its worst. And while they may think they are attacking me, and they may think they are hurting me, I beg to differ. I believe it is you, the people of Mississippi, that are being attacked. It is you, the people of Mississippi, that are going to be harmed by this action. Now, I absolutely hate that we're talking about this again. I know that people at home, they don't care about the nuances. They don't care about the fights going on in Jackson. They don't care about the power play that is out there. All they want is for us to send them the money. But the fact is, when the legislature rushes back on less than 1 day's notice, don't read the bills, they make mistakes. In fact, I believe they made a real big mistake. At this point, they really haven't even sent us a bill. They've sent us a piece of paper. Now, I've heard repeatedly that they claim that all of this is about the Mississippi Constitution. Well, the Mississippi Constitution says a lot of things. One of the important rules it sets forward is the requirement of the legislature to spend 1 full day in session such that every legislator gets the right to reconsider their actions. They cannot send a bill to me unless they do so. Every single legislator has a constitutional right to hold a bill on a motion to reconsider the day after it passes. Just because they're in a hurry to steal the money does not mean that that constitutional right of every legislator is ignored. Not only does the Constitution require that, in Article 4, it reads, all votes on the final passage of any measure shall be subject to reconsideration for at least 1 full legislative day. That's the Constitution that should apply not only to all Mississippians, but to all of our legislators as well. But that's not the only place where one's ability to reconsider is considered. When a question has once carried in the affirmative or negative, it shall be in order for any senator to enter a motion for the reconsideration thereof. That's Rule 126 of the Mississippi Senate rules. Rule number 127, no motion shall be entertained unless it is properly entered on the same day on which such vote was taken or on the next succeeding legislative day on which a quorum is present. The Mississippi Senate must come back. Give senators the right before Thursday. Give senators the right to hold that motion on reconsider. Or I would submit to you that it is not properly before the governor. They didn't do that. They rushed in, they rushed out, they left town, and they want to wait weeks before they come back to start the process of budgeting the CARES Act. They said that they may come back as soon as May the 18th. That's 2 weeks from today. That means that they haven't debated or discussed any of the items that we want to do to get money in your hands quickly. Now, I know all of this is, I know that's a little thing. I know that that doesn't mean anything to the people back home. But there are two important points that that illustrates. And is it true that the legislature can ignore their own rules? Sure they can. But it really highlights two important points. The legislative process is supposed to be slow. They are supposed to take time and consider their actions. They are not supposed to act quickly. Quite frankly, they are supposed to deliberate. They're supposed to ask questions. They're supposed to be able to amend bills, and that makes the process better. But they have thrown out all of the traditions to try to make a political point about their power. If this was about following the Constitution, they would have followed the Constitution. Instead, they're only following the parts of the Constitution that they believe help them gain unprecedented power. Secondly, if they can't follow the simple rules in the Constitution, how can we expect them to follow the Treasury guidelines? If they fail, we will lose money. We have been in contact with the Department of Treasury virtually daily. In fact, for an hour and 45 minutes today, I sat on a call, not only with Vice President Pence, but also Secretary Mnuchin. New guidelines are coming out from Treasury regularly. We received our second new set of guidelines late yesterday evening. In those guidelines, it makes very clear that with the CARES Act money, it is contemplated by the Treasury that the state's chief executive or equivalent is the one in charge of these funds. Now, those guidelines also make clear that any monies that are misspent or any monies that go unspent will be taken back by the Department of Treasury. And we know that the process lends itself in legislative action to not doing things that typically are illegal, but the horse trading in and of itself lends itself to spending money on things that maybe may not meet the guidelines. It puts our recovery at risk. It puts the entire $1.25 billion at risk. Now, we cannot wait for weeks and weeks and months. We're moving forward. We can't wait for them to correct all of their mistakes and reappropriate these dollars. I want to get the money out to the people that need it, and I want to do it soon. The fact is, these are dollars that have already been appropriated. They've been appropriated by the United States Congress, and they have been given to the chief executive to execute that appropriation within the guidance of the U.S. Department of Treasury. Now, let me be clear. I don't think anyone that has paid attention to this process over the last number of years has any doubt what this is about. Here's what I want to say. There are many really good people in the legislature. There are many people that are there to do all in their power to do what's best for Mississippi. And I appreciate every single one of them. And I know that there are some that want to play the revenge game. They want to come after me for some perceived slight in the past. What I would say to you is this: when this emergency is over, if you want to make a point or if you want to come after me personally, go for it. You can make up for every fight over the last 16 years if you want to. I understand that revenge is part of politics. And I'm more than willing to take my licks at the appropriate time. But this is not the appropriate time. Our people are hurting. Our people need help. And they don't need it a month from now. They need it now. Now, thank you all for giving me the opportunity to be here today. At this point, I want to turn it over to Dr. Dobbs, who is going to update us on our data, which I believe strongly indicates the reasons that we're able to make these additional decisions to reopen certain parts of our economy.
Thank you, Governor. As a way of quick update, today we are reporting 327 new cases and 7 additional deaths. This is in contrast to 109 cases yesterday, so on balance about 275 for the past couple of days. If we look at our total hospital utilization, we're seeing some relative stability. Our total number of hospitalized patients with COVID is 442, with 145 ICU patients and 78 ventilators. If we examine the trends over time, we appreciate pretty clearly that a lot of the case increases are driven by certain geographic areas, and so you'll see us increasingly focus our efforts on certain hotspots. Of the top 10 counties that have had a disease transmission over the past couple of weeks, those 10 counties accounted for 50% more or less of the total number of new cases. So working on areas where there's active transmission is going to be very important. And if you look at for the previous 2-week period and then comparing it to the 2-week period before that, only 26 counties showed increases for the most recent time period. So we will do some transition and strategy to make sure we're hitting the hot spots, understanding that some places are more severely affected than others. Just a couple of other quick messages as we go into expanding our ability to access these activities of daily living that we really need to get back into. It's a good opportunity to really make sure that people are using our masks in public. Use hand hygiene. When you go to the store, please just have one person, not the whole family. We still have a lot of COVID cases. It's still out there. And if we collectively as a community and individually make decisions that are safe, we will not only protect ourselves and our family, but help us get out of this mess that much more quickly. It's a little bit selfish for folks not to wear a mask or to not follow these guidelines in public. The only other thing I do want to mention is test availability. The Department of Health has lowered our thresholds for testing to any symptom and also to people who think they might have been exposed for whatever reason. We would like to also encourage physicians in the community and other clinics to make sure that they adjust their testing strategies and broaden testing availability as more supplies are available. We are seeing more and more availability of swabs and test kits and that sort of thing, so expect to see more testing occur in Mississippi over the next several weeks. Thank you, Governor.
Thank you, Dr. Dobbs. At this time, I'm going to turn it over to Director Michelle, who is going to give us an update on our MEMA situation.
Thank you, Governor. Just run through some items real quick. Just on a PPE update, today we completed deliveries to our Tier 1 facilities in District 1, 2, and 3, 16 counties, 22 facilities in those counties, about 5,000 surgical masks, 2,700 face shields, 1,500 gowns, and 2,000 gloves were distributed out there. So we continue to make the PPE deliveries and focus on that in our great partnership with the Mississippi Department of Health. Just remind everyone that HHS announced last week that they would be making direct shipments to the long-term care facilities, 1 week supply of basic PPE, which would be surgical masks, goggles, and some gowns. This is just an attempt to augment those facilities and their PPE as testing continues to be ramped up by the Mississippi Department of Health. This is just in a manner to assist them and help them in their PPE. Quick update on disaster declarations. I know we've talked about the April 12th storm, Easter Sunday storm that we had, historical event. We continue to work to add approximately 25 counties to the public assistance declaration, 7 counties to individual assistance. That is an ongoing process. We hope to hear something on that by the end of this week. The PA will likely come more quickly than the individual assistance will. And again, the consideration process for those two are a little bit different, so just be patient with us as we go. On the storm for April 19th and April 22nd, 23rd, those are 2 separate events. Unfortunately, they're not combined at this time, so we're doing 2 completely different separate damage assessments there. It is likely that we will get at least an additional federal declaration from that once damage assessments are complete, possibly 2, but damage estimates are continuing to increase exponentially. We worked through the weekend collecting those damages, and it does continue to rise at this time. Finally, last note, just a reminder to everyone that today starts Hurricane Preparedness Week. As we prepare, we've got our eyes on a lot of moving targets right now. Hurricane season is coming upon us very quickly, and as I've stated before, we are anticipating an active hurricane season this year. Throughout this week, we'll be providing you a talking point of consideration for everyone to think about. Today's topic is your evacuation plan. You need to know how you're going to go and where you're going to go in the event that an evacuation order is issued. So you need to start thinking about that now. I want to direct you to the Mississippi Department of Transportation's tool about routes. They do an excellent job in keeping those routes updated, what routes you need to utilize depending on what part of the state that you live in, and of those routes, which are blocked depending on storm damage. So we're tied into that with my application. Other than that, Governor, that concludes my update for today.
Thank you, Director Michelle. And today I also have with us the Director of DHS, Bob Anderson. And Bob is going to give us an update on his agency. He has done a fantastic job leading that agency for a very short period of time. Inherited, obviously, a challenging situation in many respects, and he and his leadership team have been incredible over the last number of days, and I want to personally thank him for his efforts and turn it over to him.
Thank you very much, Governor. I appreciate the confidence you showed in me in letting me take on this job of cleaning up what was really a mess. Now, the single audit that has been introduced today, the state auditor laid out all his findings earlier this afternoon. I want to thank him, and I want to thank all of the auditors in his office who worked on that. They did months of diligent work on behalf of the state, and that single audit is going to be essential to us at MDHS as we continue to move forward in carrying out our mission to serve the most needy people among us. We've been doing that during this pandemic, and we'll continue doing that. The next step for us is to take those question costs that are included in the audit and work with our federal partners to determine what the actual misspent dollars are. In the single audit, the question cost doesn't mean we owe every dollar of those funds back to our federal partners. We'll be working with them in the weeks and months to come to figure out what that dollar number is. And I'm not here today either to talk about the wrongdoing of others. Obviously, the governor asked me to take on this job as executive director to go in and fix some broken processes. We have been doing that. The agency was doing that when the governor appointed me 2 months ago. But as I said the day he appointed me to this position, it was very obvious that the former executive director, John Davis, treated the money of this agency as if it were his. If you look at the single audit report, you will see how many different ways Mr. Davis treated the agency's money, your money, taxpayers' money, as if it were his. Now, what I do want you to hear from me today, though, is the steps that we are taking to right the ship. That's the job that the governor asked me to take on. That's the job that I've been committed to since day one when I arrived there. And you'll find me at that office at DHS most nights till 8:30, 9 o'clock at night, working to right the ship. Some of the things that I'm going to tell you were already in place when I got there, but we have moved them forward. For example, the state plan for TANF has been rewritten altogether to include a stipulation that no TANF funds will be distributed or dispersed to non-state agencies without going through a competitive procurement process. That's a new item, a new tool in the toolbox for MDHS. The sub-grant manual has been rewritten to strengthen its controls, to require general ledgers to be included with outcome reports about the work that those sub-grantees are doing. We're doing risk assessments now to perform risk assessments on sub-grantees before they are awarded these grants. Our programmatic monitoring of those administering our grants has been made more robust, and with a minimum of 2 monitoring visits per year. Sub-grantees are now being given actual on-site training at the state office of the Department of Human Services to make sure they understand the agency's expectations and that they share those expectations with the second-tier sub-grantees, the people to whom they give the money that we have granted to them. We're giving technical assistance to those sub-grantees who are considered high risk. Department of Human Services created an Office of Inspector General to coordinate internal audit and investigations. And sub-grantees now are paid on a claim reimbursement basis and not a cash advance basis. One of the things I'm personally proudest about, which I was personally responsible for, was creating an Office of Compliance in the Department of Human Services, because it is part of my vision for creating a culture of compliance for the entire agency. And we appointed Sandra Griffith as our first Chief Compliance Officer. She came on board Friday, May the 1st, and she will be working with our sub-grantees and with our quality control staff to make sure that that culture of compliance permeates throughout the entire agency. That's my commitment to you, Governor Reeves. That's my commitment to the state of Mississippi. And that's the work that we're about at the Department of Human Services. Thank you, Governor.
Thank you, Bob. I sincerely appreciate you and your team's work. What you just heard from the director of DHS is the model that we, under my leadership in the Reeves administration, are going to adhere to. And that is critically important. We owe it to the taxpayers. And I've been called a lot of things during my 17 years in public office, but I've never been accused of not being the most fiscally responsible person in the room, and that will not change. With that, I'll open the floor to questions.
You mentioned that you believe that the reading of the state constitution would indicate that the legislature needs to return. Are you going to await that return before making a decision about what you do with that legislation, if you veto it or sign off on it?
We are evaluating it. I've been asked repeatedly if I was going to veto the bill, and my answer to that question is, and I'll ask every single one of you in this room, and you don't have to respond, but wouldn't you? Wouldn't you veto the bill? Wouldn't you fight for the people of Mississippi who need money not on May the 18th, but that need money now? You know, our barbers and our salon workers, they don't need to wait 3 weeks or 4 weeks. And that's the intrinsic problem with this power struggle in the middle of an emergency. I've been in an office barely 100 days. First thing that we ran into was the prison crisis. The second thing that we ran into was the scandal at the Department of Human Services. The third thing that we've dealt with most recently, several months ago, was the flood. First time since 1983 we had anywhere near that kind of water in and around the Pearl River. Then it was the tornadoes. And on top of all of that, we've had the first pandemic in 102 years in America. This is not the time for petty politics. This is not time to argue over control, over power, over revenge, over getting back for some past misdeed. We're going to have plenty of time for that. And I understand that's part of politics. And I don't hold any ill will towards anybody that wants to play that kind of politics, normally. But not in the middle of these crises. It's not fair to the people of Mississippi.
Considering that they overwhelmingly passed it in both the Senate and the House, so it's veto-proof by all estimations. So why waste the time to do that when you're going to lose at the end if you don't go to court and potentially have a chance to win?
Could you
I'm saying-
ask the question one more time just to make sure I understand?
Yeah, I'm saying.
Why waste the time to veto it?
Let me say the question over so we can get the full question out there. They overwhelmingly passed. It's basically veto-proof by all estimations. You veto it, it's going to go back, and they're going to pass it overwhelmingly. The only chance that you could have of doing something about it is go to court. If you don't go that option, why veto it if it's going to become law?
Well, the first thing I would say is that I've been around the legislative process long enough to know that the first vote doesn't guarantee the second vote. Someone who votes in the affirmative on the bill may not have been told the whole truth on the front end by whomever they were talking to. The circumstances may have changed. So I'll give you an example. I'm sure that everybody in the legislature knows this, but the Department of Treasury issued new guidance yesterday. And they're going to continue to issue new guidance over the next several weeks and months. And we as a state are going to have to be nimble enough to be able to move with that. It may be that the new guidance that they issued yesterday may be enough to change some of the votes in the legislature. I've had many conversations with legislators over the last couple of days, and I will tell you though, you're right. If the issue is, does the legislature have the power, or does the governor have the responsibility and power? It's really hard for legislators to vote against their own interest, right? Everybody knows that, and I'm not mad at them about it. That's been the facts for years and years and years. But this issue should not be about legislative power or governor's responsibility. It ought to be about what are we going to do to respond to the people of Mississippi to get money in the pockets of those who need it quickly. I've been fighting this virus since March the 11th. The people at the emergency management agencies throughout this state, who, by the way, I spoke to 120 of them this morning, have been fighting this virus every single day since March the 11th. We're talking 52 or 53 days. I've lost count exactly. And when I say that, I don't mean coming in at 8 on Monday and leaving at 5 on Friday and just forgetting about it over the weekend. I mean, this has been all-consuming. And I'm not complaining. I worked pretty hard last year to get this job. But the fact of the matter is, we have got to be able to respond to this crisis. You're right. It is an uphill battle for us to be able to get the votes to sustain a veto. It's an uphill battle, no question. But some battles are worth fighting for. And so what I would say is, if you're watching this back home and you believe that emergency management, the way in which we ran it during Hurricane Katrina, the way in which we as a state ran it during the BP oil spill, the way in which we as a state run it every single year when tornadoes hit, if you believe that's the best way to manage an emergency, then I hope back home you'll talk to your legislator. Be nice, by the way. You don't have to curse them out. Just say, hey, we think that the way the governor's handled this has been pretty good. He hasn't done everything I wanted him to do, but it's been pretty good. You know, we've worked across the aisle. Remember when the African-American pastor from Natchez was here? I had to chuckle a little bit when he looked at me and said, Governor, now you know I didn't vote for you, right? He said, but Governor, you are my governor, and if you're not telling me I have to close my church, you're just asking me to, then I'm going to do what my governor asked me to do. Because that is the spirit of Mississippians. We are all in this together. There is not a time in the middle of an emergency for a power grab.
Sydney Darden from WTBA has a question.
Great.
Sydney?
Yes, my question is in regards to, we have a lot of large gatherings still going on here in North Mississippi, particularly with flea markets, and with the new guidelines and mandates, even though thousands of people are still coming to all these gatherings, how should local law enforcement be handling this situation, since the social distancing doesn't seem to be they aren't taking that seriously?
Yeah, I will tell you, and that is something that's very important. And one of the things it's the reason we have these press conferences every day is to remind people that we are not out of the woods yet. We need you to be compliant. We need you to continue to be smart. We need you to be focused on social distancing if you are out in public, whether you're inside or outside. We need you to not be getting in large gatherings. It doesn't make sense. I know it seems like we've been doing this forever, but if we will maintain personal responsibility, and we as Mississippians will do what we say we want to do. We don't want to be told what to do by government. But if we will act responsibly as individuals, then we will be able to get back to normal much quicker. And Dr. Dobbs, I don't know if you want to add anything to that.
You know, it's a partnership. We've been busting our tails trying to make sure there's ventilators available, making sure there's PPE, making sure that if you or your family member gets sick, you have a place to go and will get excellent medical care. How can we guarantee that if members of the public don't take on their role and do the things they're supposed to? We'll do our best to make sure there's PPE and ventilators if this goes haywire. But if it goes off the rails in North Mississippi and Tippah gets overwhelmed or Corinth is having a bunch of cases, I want us all to look back and see what a mistake this was.
Renee?
Dave Elliott from WLX has a question.
Great.
Dave?
Governor, even though you question the legitimacy of the bill passed Friday, if you listen to Delbert Hoseman and Philip Gunn, they say that CARES Act money is under lock and key with the legislature, that it's a done deal. If you don't change legislative minds, and I have a two-part question for you here. One, you didn't answer earlier. Are you willing to go to court? And two, considering your tone and what I've heard from the Lieutenant Governor and Speaker, is it possible for you all to even work together moving forward?
I'll answer the second question first. Absolutely, it's possible for us to work together in the future. We must work together in the future. I think they certainly, in my conversations, everyone's made it clear that this isn't personal. This is about, in their mind, legislative prerogative. In my mind, it's about protecting people of the state of Mississippi. Now, with respect to the court, I don't think that there's any doubt that most of us in this state can agree that if the co-equal branches of government, the executive branch and the legislative branch, have a disagreement, it tends to be the third branch of government, the judicial branch, that actually breaks the tie. And while, again, I can't tell you with certainty what we're going to do, as I asked earlier, I'm curious if anybody out there wouldn't veto the bill, but we're certainly feel like if they were successful at maintaining that this continues, then I would think that at some point it's possible that the courts would weigh in and again break the tie. You've got three equal branches of government in Mississippi, and you've got three equal branches of government in the United States, and when the legislative branch and the executive branch disagree, then the judicial branch ultimately decides it. We've seen this in Washington, by the way, so often in the last 3.5 years. How often has Speaker Pelosi and Minority Leader Schumer disagreed with President Trump? I'll tell you how often. Every single day that the president has been in office, they've disagreed with him. And the president continues to do things to protect Americans. He's done it in this coronavirus situation. He's done it with respect to building a wall to protect us from illegal immigration. He has done it repeatedly. And oftentimes, whether it's states, mainly liberal Democrat attorney generals, or it's the Congress, they have taken him to court, and ultimately the judicial branch makes those decisions.
Kaylee Skinner from Mississippi Today has a question. Kaylee?
Hi, Governor. You've talked about this a lot today, but Speaker Philip Gunn sent you a letter criticizing what you've said about the legislature's actions. What do you have to say to his statement that what you've said about what they are doing is, quote, completely incorrect and misleading?
Kaylee, I'm sorry, but I honestly don't have any idea what you're talking about. I've spent the entire day today working on coronavirus response, so if you have a letter, I'm sure I have it somewhere, but I haven't read any letter from the speaker or otherwise. But I'll be happy to comment on it as soon as I see it.
Taylor Vance with Daily Journal has a question. Taylor?
Yes, I have a question for Governor Reeves and Dr. Dobbs. This morning, Dr. Lou Ann Woodward, the Vice Chancellor of UMC, tweeted that the number of COVID-19 positive patients, hospitalizations, and deaths are increasing. And she also said that the state has not hit its peak, and we are not on the other side of this. My first question is, Dr. Dobbs, do you agree with this statement? And then my second question is to Governor Reeves. If the data that Dr. Woodward is presenting is true, do you think that it's time to start loosening restrictions as you've done today?
Yeah, so we've been talking about the hospitalization data forever, right? So that we talk about it every day, and we have been seeing increasing number of patients in the hospital, although some stability in other metrics like ICU utilization and ventilators. One of the other challenges we're running into that I know that UMC and every hospital is experiencing, as people are having to access health care that they've delayed, there are more people going in the hospital for non-COVID related issues, and this does also put additional strains on the system. So those are real issues to be concerned about. As far as the peak goes, we're still recording a lot of cases. I wouldn't say that we know when our peak has been so far. If you look back at our website, you can see the singular date of most cases reported was around April 20th. But as we go forward, until we see it in hindsight, we won't know when our peak is going to be, and we're still clocking a lot of cases. So we'll just have to see, when that is. But we have seen, some relative stability, but we'll have to follow those metrics closely.
Yeah, I would just follow that up by saying, the chart that we look at most closely is a chart that has at the top COVID patients that are hospitalized. The chart just below that is the number of patients that are suspected to be COVID related that are hospitalized. And so if you add those two together for the last 25 to 30 days, the number has been very, very constant. Same is true because the third data point there is the number of ICU beds that are being utilized. And the fourth point is the number of patients on ventilators. And the number of patients on ventilators have been between 75 and 85 now for probably the last month or so. And so while we certainly haven't seen a downturn, what we would suggest to you is the reason we hadn't seen the downturn like, say, New York has is because New York had a huge peak. And when you have a huge peak, then you end up getting on the other side of it. We actually, because Mississippians were appropriate in their social distancing, we never have seen the huge peak. We went up, and now we've plateaued, and we've been within a fairly constant range for 30 to 35 days. So.
Dr. Dobbs, just for clarification, are you saying that we've seen our peak or we have not seen our peak?
We don't know. I mean, the day that shows the most cases so far is around April 20th. But, cases come in, and so we don't really say we have about a 14-day look-back window because we don't know, when people became ill and then labs got done and all that sort of thing. So we don't really know for sure.
Then why say we've reached our peak at that moment?
I've never said we reached our
You
peak.
said we are at the plateau of our peak. It's important not to let our guard down. That was on 2 weeks ago today.
Well, I mean, it's been flat for a long time if you look at it. We've never said we've passed our peak, and we've always been watching it, and it's been flat or flattish, for weeks and weeks. So, I mean, we can parse the words, but we've never really thought that we've seen our peak.
And so
clearly.
let me point one thing out, because I think it's important. Again, when we look at the data, I mean, obviously we look at the daily new cases, right? We look at that on a daily basis. But we all know, just like we saw on Friday, daily new cases are largely contingent upon when the testing gets done. The reason our model has worked and the reason we haven't seen the large peak that our neighbors in Louisiana saw is because we're immediately contact tracing. And so we actually know date of onset of illness. And that's really the more important data point to us than is, hey, today we could have 600 cases tomorrow, but the onset of illness, we may get a testing dump from February the 10th, and that doesn't do us any good. So it's about date of onset of illness more so than anything else. And keep in mind, and as I was talking to Dr. Burks on the call earlier today, when we talk about number of cases and peak, and I don't want to minimize this at all, but let's just keep in mind that our overall numbers are very, very small relative to many of these other states. So, for instance, I would submit to you that the state of New York reached its peak well over 2 weeks ago in terms of hospital utilization, and I believe in terms of deaths, pretty close to 2 weeks ago, certainly within the last 10 to 12 days. But yesterday in New York, they had as many deaths from COVID-19 yesterday as we've had in this entire time. And so if you only look at certain criteria, the data is the data. But the important point is to recognize that every particular state is different, and every particular region and every particular county in our state is different. Dr. Dobbs said on Friday that he went to Scott County. That's an area we're watching very closely. We were talking over the weekend, several of us were, and Scott County has, over the last 14 days, has had approximately 100 new cases. Alcorn County, meanwhile, over the same 14 days, has had 1 new case. Well, that's the reason Dr. Dobbs was in Scott County, and we're pushing resources there because we're actually monitoring the data and making sure we're protecting Mississippians.
I guess you can imagine the angst that people are feeling at this moment when you have a stark warning from the largest hospital in the state that's probably leading the charge in coronavirus treatment, response, etc., that says that this peak is not here. And people are feeling, okay, the peak isn't here, but you, Governor, are opening up this perhaps allowing more people to get exposed. What's your response to that? That we're not anywhere near people feel opening the door.
Yeah, what I would say to you is this. In our state right now, and quite frankly, mostly in our country, but I can just speak to my constituents because I listen to them and I hear them. In our state, we have 3 million Mississippians that have some level of angst. There may be some that are really scared of the virus. There are a whole bunch that are really scared of their economic plight. We've had 302 Mississippians pass away, and every single one of those deaths are tragic. Every single one of them. We've also had 200,000 Mississippians that have lost their job, that are wondering where their next meal is going to come from. And so when you ask me, am I surprised that people have angst? No, I'm not surprised. I have angst. I have concern about every single decision we make. Did we do it too early? Did we do it too late? If we did it too early, did it hurt more people economically than that we could have avoided? If we did it too late, is the public health crisis before us? Understand, these are decisions that no one that's currently alive today has ever had to make. And we're doing it on the fly. It's the reason, by the way, we need to be dynamic in our response. We need to be able to be on a Friday and say, okay, we got 390 new cases today. Let's take a step back. Let's analyze the data. You can't do that by committee. It takes someone that is an executive that can make a decision. I'm willing to make the decisions. I'm willing to take the blame. If you have angst and you're mad at the response in Mississippi, blame me. Blame me.
Nick Juden with Jackson Free Press has a question.
Great.
Nick?
Hi. Speaker Gunn suggested that his office has been in contact with, for example, Mississippi's unemployment agency for the last 5 weeks, and that they've never requested more funds. This is from the letter that Kaylee wrote earlier today. You suggested that MDES might have to lay off 300 of its 350 employees if the CARES Act funds are transferred. How much money does MDES need not to pay claims, but to maintain its current workforce?
Could you tell me how long we're going to have to stay at 350 employees? Can you tell me how long the contract is going to be that they entered into to plus up the number of people at the call center? Are they going to work until June 30th? Are they going to work until December 30th? Are they going to work until September? Are they going to work until October? Are they going to be done October 15th? Because I can tell you, Nick, I have no idea. But this is what I do know, because the United States Department of Treasury said it in guidance that they provided yesterday. Frequently asked questions. Do governments have to return unspent funds to the Treasury? Yes. Section 601F2 of the Social Security Act, as added by Section 5001A of the CARES Act, provides for recoupment by the Inspector General of the Department of the Treasury of amounts received from the Coronavirus Relief Fund. So the reality is that if you're not nimble, if you can't make changes on the fly, if you can't leave enough money to make sure that those 350 people can be paid all the way through December 30th, then the reality is you could potentially be leaving money on the table that needs to be getting out right now to the people who need it. And so that's the problem. There are so many questions that are yet unanswered. Oh, by the way, I've been talking to manufacturers around the country. I've been talking to manufacturers around the state. A lot of them are working right now. They had a pretty big backlog when coronavirus hit. Unfortunately, when 200,000 Mississippians are out of work, and when millions and millions and millions of Americans are out of work, businesses quit putting in orders. So my question to you is, I know how many unemployed people I have right now, but if the economy shrinks in the second quarter by 4, 5, 6%, how many additional unemployed people are there going to be in July? How many additional unemployed people are there going to be in September? And I don't know the answer to that. And yeah, anyone can argue, well, all you got to do is just call them back into a special session. Well, that costs taxpayer money too. And so, again, I'm not going to be able to answer specific financial questions between now and December 30th, how much it's going to cost, for a lot of reasons, not the least of which is, I don't know, are we going to have a fall coronavirus season? Is it going to come back in September? Is it going to come back in October? Is it ever going to go away in the summer? I honestly don't know the answer to that.
Jennifer Kay with Bloomberg Law has a question. Jennifer?
Thank you. Governor, I was hoping you could share some more information or some updated information about what the Coalition of Southern States is working on. It feels like most states are moving forward with their reopening plans individually. So I was wondering if you can give us a sense of how Mississippi is benefiting or has benefited from being part of that coalition.
Well, the governors of Florida and Georgia and Alabama and Mississippi and Tennessee, we have been in pretty regular contact over the last 8 weeks or so. We're all working tirelessly to make sure that we make the right decisions to respond to this virus. But we all have different, unique situations. I think if you look at the 5 states that I just mentioned, our reopening plans are probably as similar amongst those across the country that have started the process of reopening as anyone else in other parts of the country. We're not identical because we have slightly different makeups, but generally speaking, what you're seeing from those states in the Southeast is that we're trying to reopen in a smart and safe way.
Hunter Dawkins with the Gazebo Gazette has a question. Hunter?
Governor, how are you? That being said, my question is, I spoke with the coastal delegation this weekend, and I was told really that this legislation that has been problematic is something that was pre-COVID, that it was worked on, and that the key word of this was transfer from one account to the next. And the individuals of the delegation told me they're really scared about the carefulness in these times of dealing with the Constitution. And I guess could you just give me some of your thoughts on that?
Well, my first thought is if this legislation, they had been thinking about it before COVID, they have incredible foresight because the CARES Act wasn't even passed until a month or so ago, maybe less than that. If you'll recall, much of this money was debated and discussed, and it was for the chief executives to use on our response. I will tell you, any legislator who says that they are concerned about the Constitution, here's what I would tell you. You should be. Every single legislator takes an oath to uphold the Constitution. That's serious. And they should work to uphold the Constitution. And the Constitution is very clear. And nobody knows this better than I do, by the way. For those of you who have been watching state government for a few years, I'm relatively familiar with the legislative process. And there is no doubt that the Constitution gives the legislature appropriating authority of state dollars. When our Constitution was put in effect in 1890, the federal government wasn't sending large amounts of money to the states. These dollars are federally appropriated dollars that are to be spent based upon the guidance of the Treasury. In other words, the only role the state plays in these dollars is to execute what the appropriated dollars from the feds, based upon guidance from the Treasury, says. We have a general law in our state. A general law, by the way, which was not amended on Friday, which speaks to how to deal with federal funds in an emergency. It is crystal clear. If the legislature believes that they are entitled by the Constitution to spend these dollars, why did they change a state statute, a state law, to do it? Because they're changing the rules in the middle of the game. And that's what they've chosen to do. It hasn't become law yet. That's what they've chosen to do. And again, what we have is a difference of opinion on what is the best way to manage in the times of emergency. Is it the way in which we managed during Hurricane Katrina? Is it the way in which we managed during the BP oil spill? Or is it not? Now, to my friends in the Coast delegation, because I think you mentioned you had talked to some of them, My concern, if I were them, is does this mean that the BP money is now eligible to be spent all over the state? Is the legislature going to appropriate that money for Alcorn County? Is that what? I just think that's something that they really ought to spend a lot of time thinking about. Because I fought that battle, and it's not an easy battle either.
Bobby Harrison with Mississippi Today has a question.
Great. Hey, Bobby.
Hey, Governor, how you doing?
I'm good. How are you?
Look, you were asked Friday if the legislature left $100 million of that $1.25 billion in a fund for you to use for those immediate needs like helping barbers and hair salons and whatnot. And,
No, sir, that is incorrect.
It's not going to be enough, and in your time at Friday, you indicated that you might not be able to pay unemployment benefit. But Section 3 of the bill that was passed Friday makes clear that it's only dealing with about $1.25 billion, and the $1.25 billion is not where the unemployment benefits come from. So, I mean, I just ask you again, what can you not do with the $100 million in the next, between now and the end of the budget year on June 30th?
Yeah, so what I would submit to you, Bobby, is that your original premise is wrong in that you said I could use that $100 million for barbers and salon operators. That's fundamentally false for the following reason. The Section 3, which deals with FY20, Section 2 deals with FY21, but Section 3, which deals with FY20, says that these monies can be escalated, quote, for defraying expenses incurred by any state agency, department, or institution. So these monies could be spent for a state agency, a department, or an institution. I do not believe that it gives me the authority at this time. Now, admittedly, our lawyers are still reviewing it, but at this time, I read that to say any state agency. With respect to other state agencies, what Section 3 says is in this particular fiscal year, DFA, our finance agency, can only escalate funds up to this $100 million. Where they made a mistake, in my opinion, is even if they wanted to handicap us, even if they wanted to take the money and limit our spending, they should have said in Section 3, not for purposes provided under the Coronavirus Aid, Relief, and Economic Security Act, which includes all the money that the CARES Act spends. The $1.25 billion is a limited amount of the CARES Act. Remember, the CARES Act, and again, this is details that, and I'm willing to answer it, but I don't know that there are a lot of people back home that care, but the CARES Act gives Mississippi $1.25 billion specifically to the executive to manage through this crisis. Now, the total amount that goes to cities, counties, and other jurisdictions is $150 billion. Remember, the CARES Act is almost $2 trillion in aggregate, in total. And so if they had said there for the Coronavirus Relief Fund, then that would have given us much more flexibility in escalation authority and other budgets across state government. And while I still may not have liked it, it would at least have potentially given us more of an ability to manage through it. And so that's the distinction. It is the what I believe to be, I'm sure, a simple mistake, that they applied it in Section 3 to the entire act, not just to the Coronavirus Relief Fund, which is the CRF, which is what the Department of Treasury actually provides guidelines on, is the Coronavirus Relief Fund. Renee?
Desiree Frazier from MPB has a question.
Awesome.
Desiree? Desiree? Desiree, can you hear us? Nick Juden has another question from Jackson Free Press. Nick?
Hi, this is a question for both Governor Reeves and Dr. Dobbs. Friday was the highest increase in COVID-19 cases, which you suggested was a result of a data dump. And today is the second highest increase so far. Surely there is a number of cases or a trajectory of cases that would lead us to reverse course on opening the state. Can you give us precise information on what would cause that?
Well, thank you for that question, Nick, and I'm going to let Dr. Dobbs answer it. But this is one of the things that sometimes concerns me about selective use of data, because you're right. What you said is technically, factually accurate. That the largest day was Friday, the second largest day was today. But the little minor fact that you left out is on Saturday we had approximately 33% less cases than we had on Friday, and on Sunday we had 50% less cases than we had on Saturday, or literally less than a third. So if you look at the 4-day moving average, which we typically look at the 3-day moving average, but if you look at the 4-day moving average, what you find is we have averaged over the last 4 days somewhere between the 250 and 270 cases that has been pretty consistent over the last 10 days or so in terms of the total number of cases. So,
yeah, and I'm actually glad you brought that up, because there's another point that's very important. Numerous metrics are going to be valuable in us figuring out where we're going. And if you look at some of the models that were created, they never even looked at total cases. They looked at deaths, because cases is so dependent upon testing strategy. So we did report 7 deaths, and I think that's certainly something we want to monitor, because that's an event that's a lot easier to identify than a case, because so many cases are asymptomatic or don't get diagnosed. As we change our testing strategy and are more aggressive about going into high-risk areas as far as around long-term care and other outbreaks, we are definitely going to see a lot more cases. So that's one thing that's going to happen is it's actually a way for us to actually know we're doing a better job if we're finding cases around outbreaks. So one of the things we're going to start doing is separating it out by community spread and outbreak related, and then that'll also help us get a better idea of where we're going as far as the state is concerned. But it's going to take multiple measures, both the hospital utilization, death rate, case rate, and also the percent positive tests going forward that we'll use to kind of help make sure that we're making the best decisions.
We're going to go back to Desiree with MPB. Desiree? Desiree, you're unmuted.
See it.
Desiree, we can hear you. You're unmuted.
Desiree, do you have a question?
All right. Bobby Harrison from Mississippi Gate has another question.
Right.
Bobby?
Governor, just following up from a while ago, I know we're getting deep in the weeds, but I think this is an important point, because you're saying it's going to impact unemployment benefits, what the legislature does, it has the potential to. But if you read Section 3, it states clearly it puts coronavirus funds are in State Fund 682011300. Those are the only funds being impacted by this legislation, and the only funds in that fund account are the 1.25 billion. So I'm going to ask you again, what can you not do with the $100 million that you're given? I mean that seems like that's a lot of money to deal with the issues between now and the end of the budget year. And also, are you going to call the legislature back in special session to take up the motion to reconsider? You said they should come back Thursday, so are you going to call them back in special session?
No, I can't do that, Bobby. Because if I call them back in special session, that's a completely different session that they maintain the right to bring themselves back. And I think probably the right thing to do would be for the House not to come back, but the Senate to come back, because the Senate rules are very clear as to this motion to reconsider. And it may be that there's a deadline on Thursday to actually sign or not sign the legislation, but yet if they don't come back, we'll have to make a legal determination as to whether or not we are, whether it's an actual bill or not. And so that's obviously a very messy thing. But we'll certainly do it. Bobby, I think you've got to take the entire amendment, if you would, and ensure that you read not only Section 3 but also Section 2 which the escalation for fiscal year 2021, again, another point going forward, has to be specifically authorized in an appropriation bill for the agency. So what we're going to find ourselves doing is if a particular appropriation bill is either worded wrong or just doesn't completely include certain things, or if in fact through the CARES Act, HHS, for instance, pushes out more money for testing, which we certainly saw that. There's $25 billion in testing for the states and for the federal government. There may be a point at some point that HHS in July or August or September gives the Department of Health a $10 million grant or a $50 million grant. You cannot put specific escalation authority into an appropriation bill unless you know that money is coming. And there's no way to know in June what federal money is going to come in September or October or November. It's the reason in every other situation. In my 8 years as lieutenant governor, we gave these agencies the ability to escalate federal money for that reason, because again, federal money is already appropriated by the Congress, and the state is required to meet those guidelines. Let me say that again. The federal money is appropriated, approved by the president, sent to the states, and the states have to spend it in accordance with the guidelines of the specific federal agency that the Act gives the responsibility to. So, for instance, money that comes from FEMA, for the purposes of MEMA, they have the ability to increase their escalation for federal funds as long as they spend that money in compliance with federal guidelines from the Department of Homeland Security.
For clarification, I guess this goes to Dr. Dobbs. In the executive order, it says that customers must be screened. Is that basically take a temperature test at the door? What does that entail for a customer to be screened before they sit down?
Making sure that there's no symptomatic illness. There's no mandate for thermometers, in the sense it's entirely impractical. And there's also a shortage of the non-touch thermometers. But it is very important to make sure we don't have ill folks, coming into a restaurant. Certainly, again, want people to exercise really good judgment about staying away. And if you're older or if you have chronic medical conditions, just really stay in as much as you can, because this thing is not over. We've got a long way to go, but we do understand we've got to get back to a little bit of normalcy.
Hunter with Gazebo Gazette has another question. Hunter?
Governor, do we have any plans soon of opening up churches, at least towards capacity size, sort of like retail stores?
Yeah, churches are not closed in Mississippi. We made a decision early on that the government does not have the responsibility to shut down churches. We have provided guidelines. We have discouraged churches from meeting in confined spaces inside buildings. But we've got a lot of churches meeting in other ways. They're being creative. What we don't need is large groups in small confined spaces. And we also need to recognize when it comes to churches that the choirs are potentially a real challenge because people sing, and they sing loud, and they express themselves, and sometimes they express germs out into their neighbors. And, I've seen a couple people in the room kind of smile. But it's actually something that we've seen, and we've actually had outbreaks amongst churches in large part because we saw it in the choir.
Nick with Jackson Free Press has another question. Nick?
Governor, what is an appropriate percentage of the funds for a third-party administrator to take from the $1.25 billion as a fee? A range is fine.
I honestly have no idea. As you know, we did an RFQ, and the group at the Department of Finance and Administration, the experts that are doing the analysis on those RFQs, I think they were due today, if I'm not mistaken. And once they go through them and make a recommendation, I'll be certainly happy to tell you exactly what the funding structure is and kind of what the guidelines were and what the range was. My anticipation is that it would be very, very, very low, and it would be significantly less to pay for compliance on the front end than for the Department of Treasury's Office of Inspector General to come back against us. You know, Bob Anderson is here, and Bob is here in large part because there was an audit done on his agency in which there was some allegations and accusations regarding misspending money. This alleged misspent money, and again, I simply say alleged not because I'm belittling what the auditor says, because I don't know all the details about that, but there is a court case and people have been arrested and everyone's entitled to their day in court. And so I just say alleged for that reason, not for any other. But much of that alleged misspending occurred in 2017, 2018, 2019, and the auditor, doing what the auditor's office is set up to do, investigates misspending perhaps in years past. Now, I presume that there's been a single audit every single year at the Department of Human Services. Every single year there has been an audit at the Department of Human Services, but this particular one goes back a number of years and says, well, maybe this was wrong and maybe this was wrong. These are things that perhaps they missed the first go around, and that's okay. The good news is we have a very capable, competent auditor who is going back and looking, and that's all fine. But the reality is, if we had perhaps, because this is federal money that we're dealing with, if we had set it up such like we did in Hurricane Katrina, where we had $5.4 billion, and we had some pre-compliance to make sure that before we actually spend that money, that it complies with the Treasury guidelines. Obviously, I have a very good relationship and personal relationship with Secretary Mnuchin. I was on a call with him earlier today, and I appreciate that, and I think that's very helpful that we have that relationship. I have a good relationship with the president, and I appreciate that. But I want to just give you a little bit of information. The Board of Cosmetology regulates 5,028 salons. They have 43,134 individuals that are unable to work right now because of the executive orders. The Barber Board has approximately 2,300 barbershops that they regulate. They have 5,600 individual barbers. So we're looking at, if we gave money, and we're going to hopefully announce a plan soon, to the 7,500 salons and shops and to the nearly 50,000 individuals who work there, I'm not going to be able to sit down and call up Secretary Mnuchin and say, hey, Secretary, you think that this meets the guidelines? We've got to have a team that can cut those 50,000 checks, get them in the right hands, ensure that they're being spent for the right things that are going through that comply with the guidelines, so that the OIG doesn't ultimately come back and hold us accountable. Because that's what's going to happen. If HHS, who has an OIG, who we are working with now, I presume, comes back, looks at these funds, says you may owe it back to their particular agency, then we're going to have to pay it back. But the fact is, we want to pre-clear this so we limit the amount of cost. And so my answer to you is this. It is my estimation, as the Chief Executive Officer of the state, as the person that Mississippians placed their trust in the election last year, that we taxpayers would be significantly better situated in the event that we pre-clear the money and don't owe millions and millions or potentially hundreds of millions of dollars back to the Treasury in this instance. Thank you for your questions. I don't see any more. I appreciate y'all. Have a great day. And to all Mississippians, please stay safe and God bless.